Hello everyone, welcome to Let's Medicine. So today the topic of study is gastritis. What is gastritis basically? It's the inflammation or erosion of the gastric lining that is sometimes also called gastropathy. And what causes gastritis? Alcohol, NSAIDs use, Helicobacter pylori can cause gastritis, portal hypertension, and stress factors such as burns, trauma, sepsis, and multi-organ failure can cause gastritis. So, how we diagnose a case of gastritis? Gastritis often present with the gastrointestinal bleeding without pain. Severe cases of gastritis can also present with a big gastric pain, and if a patient gives a history of NSAIDs and alcoholism, that can lead us to gastritis. A point to remember is that atrophic gastritis is associated with vitamin B12 deficiency. So gastritis can present with different degrees of bleeding, and the volume of the bleeding can be assessed with the manifestations. For example, if there is coffee ground MSS, so we can assess that volume of bleeding might be 5 to 10 ml. If there is a heme positive stool, then the volume of bleeding might be 5 to 10 ml. And if melena is present, that is blood in stool, also called black stools, so the volume of bleeding can be from 50 to 100 ml. So what are the diagnostic tests? Only the upper endoscopy is a definitive test for the diagnosis of gastritis. Capsule endoscopy is not appropriate for upper GI bleeding. Test for the Helicobacter pylori should also be performed because if it is associated with gastritis, so it should be treated. And what tests are performed for the Helicobacter pylori? It's the endoscopy biopsy, serology, urea breath testing, and H. pylori stool antigen test. So what's good about endoscopic biopsy? It's the most accurate of all the tests, but it requires invasive procedure. Serology. It's an inexpensive procedure, but it lacks specificity. The urea breath testing is positive only in active infection and it is non-invasive, but it requires expensive equipments in office. H. pylori stool antigen, it's positive only in active infection and it's also non-invasive, but it requires stool samples. What are the treatment options? The treatment options include PPIs, H2 blockers, sucralfate, and liquid antacids. Note that H2 blockers, sucralfate, and liquid antacids they are not as effective as PPIs. So that was pretty much it about gastritis. Thank you for watching. Meet you in another video.